questions about what a physical therapist does exactly when working with horses. So I've put this little video together of one of my clients to show you a before and after from a PT session. So as you can see in this video, this horse came to me with complaints of bucking and just general grumpiness under saddle. So I start off with my assessment, and for the sake of time, I'm just showing you guys a very abbreviated assessment here because I already know exactly where this guy's painful spots are, which is right there. So we think most of his problems are stemming from some back pain due to working in an inverted and hollow back posture. And you can see the difference between when I pushed at first on that vertebrae that was not painful, and then when I find another one here, when I hit a vertebrae that is responsible for some of his back pain. So then when I go into my treatment, kind of the first place I started with him was just some gentle massage work along his paraspinals, trying to get him to calm down and just alleviate some of that pain response. He was really anticipating pain anytime anyone was going to touch his back. So this kind of helps relax the muscles and helps him realize that something touching him there doesn't have to be a painful event. And a lot of times, even though the muscles aren't the root cause of the pain, when a horse is having pain, the muscles will get really tight and guarded, and doing some massage work can help decrease that muscle guarding and kind of return the muscles to their normal resting tension. So then the next thing we went into were some belly lifts, which are one of my favorite exercises, but this is more of an active stretch for him. So those vertebrae kind of pinch together at the top there, and by lifting his back with the belly lifts, he's helping to separate those vertebrae actively. It's also a strengthening exercise for his core, so when we start working more into some in-hand work and ridden work down the road, he'll be stronger and more prepared for carrying the weight of the rider, so we can prevent this problem from happening again. You can see he's a little fidgety, but overall Trace does really well with these. So then I move into some posterior pelvic tilts. It's the same idea as those belly lifts, but we're just working a little further into his low back. And then we also went into some side bending stretches, but with his head nice and low, so he's getting that back raise as well with these. And then the last thing I do is go back through and kind of reassess. So I'm going to push on those same spots I pushed on earlier that caused such a big pain response. Starting off nice and easy. You can tell he's a lot more tolerant of that pressure. I'll push a little harder here. Still okay with it. So I'm not going to go as far as saying that this horse is cured, but he's definitely a lot better off than when we started. His owner still has a lot of work to do on the ground, strengthening with some different exercises that I've given her for homework before he's ready to be ridden. But he's in a much better position now to do those exercises, that he's in a little bit less pain. Thank you guys so much for watching. If you have any questions about what you've seen here, please leave them in the comments and I will get back to you. And don't forget to subscribe to my channel for more videos.